Hi, today I'm going to talk about the public health skills that are essential for any public health professional to carry out the public health functions effectively. There are several public health skills that have been defined by different academia. The American Schools of Public Health has defined a set of skills that are essential for public health professional. I'm going to talk about those public health skills in brief. So there are 8 sub-skills that have been defined by Association of Schools of Public Health in America, and the number 1 is that analytical and assessment skills. Number 2 is policy development program planning skills. Number 3 is communication skills. Number 4, cultural competency skills. Number 5, community practice skills. Number 6, basic biological sciences understanding skills. Number 7, financial planning and budget management skills. Number 8, leadership and system thinking skills. Let us further look into a detail of under each sub skills what are the strengths that one has to develop in public health. Number 1, analytical and assessment skills, under which he or she, the public health professional, is able to define a problem, determine appropriate uses and limitations of both quantitative and qualitative data. You should be able to select and define variable relevant to defined public health problems and evaluate integrity and comparability of data and identify gaps in data sources. Apply ethical principles to collection, maintenance, use and dissemination of data information. Properly partner with the communities to attach meaning to collected quantitative and qualitative data. Make relevant inferences from quantitative and qualitative data, obtain and interpret information regarding risks, benefits to the community. Recognize how data illuminates ethical, political, scientific, economic and overall public health issues. The second skill is policy development and program planning skills. This is one of the very important skills that every public health professional has to have. It's very important in the long run to have a sustainable public health program development and to keep the community safe. What are the sub skills that one has to master under the policy development and planning skills? Let us just have a look at it. The public health professional under this skill should be able to collect, summarize and interpret information relevant to any public health issue. State policy options and write clear and concise policy statement. Should be able to identify, interpret and implement public health laws, regulations and policies related to specific programs. Articulate health and administrative, legal, social and political implications of each policy options defined, and state the feasibility and expected outcome of each policy option. Utilize current techniques in decision analysis and health planning. Decide on appropriate course of action. Develop a plan to implement policy including goals, outcome, process, objectives and implementation steps. Translate policy into organizational plans, structures and programs. These are quite essential under this. And develop mechanism to monitor and evaluate program for their effectiveness and quality. The second skill is very essential to look at the policy and its planning skills, and one has to possess these basic skills under this second component. The third skill is communication skill, under which he or she should be able to communicate effectively both in writing and orally or in other ways, and solicit input from individuals and organizations. Advocate for public health programs and resources. Lead and participate in groups to address specific issues. Use media appropriately and use advanced technologies and community networks to communicate information. Present accurate demographic, statistical, programmatic and scientific information for the professional and lay audiences. Listen to others in an unbiased manner. Respect point of view of others and promote the expression of diverse opinions and perspectives. They are very essential. Most of the public health professional once they just understand the theoretical background, they usually think that they know better than the lay person. But most of the time it is other way around. They will be knowing, they may not be knowing to present the information more systematically, but they are capable enough to present the issues much better than any trained public health professional. So one of the important skill is communication skills in terms of listening to what the layperson or